All right, let's dive into one of the human body's best kept secrets. We're talking about a hidden highway, an incredible link that connects your ovaries directly to your lungs. It's a relationship that is so profound, it can literally change the way you breathe.
I know, it sounds like a weird question, right? I mean, these are two systems in completely different parts of the body, and they have jobs that seem totally unrelated. But what if I told you they are way more connected than we thought?
Yeah, the connections here are wild. They can explain everything from mysterious fluid suddenly showing up in the lungs to why some really serious respiratory conditions are almost exclusively found in women. So let's start with the most direct link of all. We're going to start with maybe the most direct and honestly baffling link. How a problem down in the pelvis can literally cause fluid to build up all the way up around the lungs. But to really get this, we first need to define a key term.
Okay, so picture the space between your lungs and your chest wall. Normally, there's just a tiny bit of fluid in there for lubrication, but that's it. When that space starts filling up with a lot of fluid, that's called a pleural effusion. And this buildup can actually crush the lung, making every single breath a struggle. So the big question is, where in the world is all this fluid coming from?
Well, in medicine, there's this really fascinating group of syndromes, all with some variation of the name MIGS, that help us unravel this mystery. They all show up with this strange fluid in the lungs, but the reasons why are very, very different. So the classic case is something called Meigs syndrome. It's a triad, a combo of three things. First, you've got a benign, so non-cancerous, tumor on the ovary. This tumor causes fluid to build up in the abdomen, which is called ascites. Then, and this is the amazing part, that fluid actually migrates up through tiny little channels in the diaphragm and starts filling the space around the lungs. But here's the kicker, the crucial clue. You remove that benign ovarian tumor, and poof, both the abdominal and the lung fluid just vanish. Then you've got the imposter, pseudo-Meigs syndrome. On the surface, it looks exactly the same. Fluid in the belly, fluid in the lungs. But the cause is different. It's not that specific benign tumor. This time, it could be another kind of pelvic tumor, maybe even one that's malignant or cancerous. And that distinction is absolutely critical, because if the fluid comes back after surgery, that's a huge red flag that the cause might be much more serious.
And just to make things even more complicated, there's pseudo-Meigs syndrome. This one is the ultimate red herring. You get the exact same fluid buildup, but there's no tumor at all. The real culprit is the body's own immune system attacking itself, like what you see in diseases like lupus. This just causes widespread inflammation, leading to all that fluid. So the clue for doctors isn't finding a tumor, but finding signs of this immune system battle right inside the fluid itself.
But listen, this whole connection isn't just about these rare, confusingly named syndromes. It can also show up as a direct result of some very common medical procedures and diseases that affect a lot of people. Two really big examples here are ovarian hyperstimulation syndrome, or OHSS, which can be a complication from fertility drugs used in IVF. These drugs can make your blood vessels super leaky, allowing fluid to just seep out into the abdomen and chest. And the other, of course, is ovarian cancer, where the disease itself spreads and causes what's called a malignant pleural effusion, where you actually find cancer cells floating in the lung fluid. So let's just pause for a second and connect all these dots. As you can see here, the why behind the fluid is everything. A benign tumor in Meigs, that's solved with surgery. Leaky vessels from fertility drugs in OHSS, that points right to IVF. And finding cancer cells in the fluid pretty much confirms a malignancy. The pause always gives you the clue. And hey, notice that last one on the list, thoracic endometriosis? This is where the connection gets even more direct and gets tied to a monthly schedule. Okay, so now we're moving beyond just migrating fluid to something even crazier. Phenomena that are tied to the rhythm of the menstrual cycle itself. This is where the ovary-lung axis becomes incredibly tangible, operating just like clockwork. We're talking about something called thoracic endometriosis syndrome, or TES. This happens when the tissue that's supposed to line the uterus, endometrial tissue, is somehow found all the way up in the chest cavity. And its hallmark symptom is absolutely wild, a catamenial pneumothorax. That is a collapsed lung that happens like clockwork within 72 hours of the start of a period. And what's truly mind-boggling is that in about 90% of cases, it's the right lung that collapses. 90%. This is not random. It strongly suggests there's some kind of anatomical highway, maybe related to how fluid flows in the abdomen, that guides this tissue from the pelvis up to the right side of the chest more than the left. So this creates this fascinating clinical paradox. The classic patient for a spontaneous collapsed lung is a tall, thin guy, and it just happens randomly. But in TFS, the patient is a woman of reproductive age, and the cause isn't random at all. It's tied directly to her menstrual cycle. It completely flips the script on who doctors expect to see walking in with this condition. So far we've talked about physical connections, right? Fluid moving, tissue migrating, but there is a much deeper, more systemic connection here, and that is the hormones produced by the ovaries. They act like powerful messengers that travel all through the body and directly impact how we breathe. Let's just take progesterone. When it's released from the ovary after ovulation, it doesn't just hang out in the pelvis. Nope. It travels all the way to the respiratory center in your brainstem. And once it's there, it acts as a natural respiratory stimulant. It literally makes your brain more sensitive to carbon dioxide levels, which then increases your drive to breathe.
But, these hormonal signals are a real double-edged sword. That same progesterone that stimulates breathing. For a lot of women with asthma, it's a blessing when their levels are high. But that sharp drop right before a period can be the trigger for an attack. And on the flip side, estrogen, especially in some birth control pills, can have a totally different effect, increasing the risk of a pulmonary embolism, which is a really dangerous blood clot in the lungs.
And for a truly dramatic example, look at a disease called LAM. It's a rare lung condition that almost exclusively affects women of reproductive age, and it's literally fueled by estrogen. It causes cysts that just destroy the lung tissue, and its hallmark is a very specific type of pleural effusion. Instead of clear fluid, it's this milky white liquid called a chylothorax, and it's full of fat from damaged lymphatic vessels. So what's the big picture here? How do we tie all of this together? We've got migrating fluid, we've got misplaced tissue, and we have these powerful hormonal signals traveling through the bloodstream. It becomes pretty clear that we're not just looking at two separate systems. One of our sources puts it just perfectly. It says that the human ovary exerts far-reaching systemic effects. It's not just a reproductive organ. Its influence radiates throughout the entire body, affecting systems we would never ever think to connect it with. So the crucial takeaway here is this: the ovary and the lungs are connected by this complex, incredible network of hidden highways. Some are actual physical pathways for fluid and cells, while others are these invisible hormonal signals that are shaping our very physiology. And that really just leaves us with one final, kind of mind-blowing question. If this powerful, unexpected axis exists between the ovaries and the lungs, what other hidden networks are quietly at work inside our bodies, shaping our health in ways we are only just beginning to understand?